now new guidelines about screening for cervical cancer, just issued by the American Cancer Society. And joining me to talk about this is Hartford Healthcare's Dr. Dan Gottschall at St. Vincent's Medical Center in Bridgeport. Doctor, welcome.
Oh, thank you. Happy to be here.
Well, tell us, what is the most significant change to these guidelines?
So the biggest guidelines, the last time they were put out by the American College was in 2012, and that recommended screening women starting at age 21. So the newest guidelines recommend performing Pap smears starting at age 25.
And what was the lead cause to this change?
Well, really, the Pap smear has become a better test. The Pap smear was invented over 70 years ago by Dr. Papanicolaou, and it's really the best screening test really in the history of medicine at preventing cervical cancer. And in the past, we would just look at the cells. Now we actually look at the cells plus test for the presence or absence of the virus called the human papillomavirus that causes the cells to change in the precancerous state. So the recommendation at the age of 21 was to just look at the cells. Now, starting at age 25, we'll look at the cells and measure for the presence or absence of the virus.
Okay. And who is most at risk for cervical cancer?
Really, everyone is at risk for cervical cancer. Everyone can get it. It's based on the fact that people are exposed to this very common virus, and that can cause the cells to change and become precancerous and even cancerous.
All right, let's talk about the HPV vaccine and who should get it and when, because I heard one doctor call this the biggest breakthrough in cancer research ever. Would you say it's that important?
Yeah, well, we talk about vaccines a lot now, but certainly the HPV vaccine actually is something that we offer for our daughters and our sons. You know, when they're adolescents, 12 or 13, the best is before they become sexually active. And that's one of the other reasons that the American Cancer Society has changed the requirements and the recommendations, is because not only is the Pap smear a better test, but we're immunizing our children, so there should be a decreased incidence.
How many shots do you have to have for the HPV vaccine, and at what ages? How long does it last?
So, you know, the vaccine has been around for about a decade. We start usually around age 12 to 13, and then it's a series of 3 injections.
And then does it last into your 20s? Do you have to get another one?
So the guidelines now is to start around age 12, and we can give it up until age 26. And we hope to be able to expand it, but it's supposed to give lifetime immunity.
All right, Dr. Dan Gottschall, thank you so much for joining us and bringing us up to date on this very important topic that's so important for women to take care of their health. Thank you very much.